Hello, in this video I'm going to show you some soft tissue techniques for the trapezius and the levator scapulae muscle. First of all, I just want to run through some anatomy, and the trapezius muscle attaches from this bump. The bump of knowledge is his nickname, but it's medically called the occipital protuberance along here. There's a line called the superior nuchal line, comes down to C2 because there's no spinous process of C1. Okay, and then you can find C2 by extending, and then it comes down by the ligamentum nuchae or nuchae ligament to C7 down to T12. So you've got the upper fibers of the trapezius here, which tend to shorten and become maybe painful and problematic. And then deep to that, from C1 to C4, the transverse process is the levator scapulae will attach and it goes to the superior angle of the scapula. Now, if he elevates the shoulder, we are going to activate the upper traps and the levator, relax. If he side bends the head, then those muscles are also going to get involved. The difference between the upper trap and levator, if Max was to lift his arms over his head, that's mainly the upper traps, the lower traps and the serratus. And if he pulls his arms down against a resistance, then levator would come in to downwardly rotate the scapula. So they'll work synergistically in some ways, but they'll work agonist, antagonist in another. I put some wax on there. I just use a fascial release wax by Songbird and it works very well. So what we can do first of all is going to treat, I've lowered the couch a little bit, and I'm going to use the pads of my fingers and I'm going to curl them slightly and I'm going to reinforce that. So I'm not going to dig in with my nails, so I'm just going to use the pads, the distal phalanx here, and then I'm just going to slowly grip in and then reinforce that. Now, with my body positioning, I have a tendency to place one knee on the couch, so I'm side on. So I'm in this sort of like 45-degree angle. So I come up onto the side here. It's hard to say, let's just focus on one muscle because we can't. Yeah, we're also going to be focusing on other muscles at the same time, like the scalenes are deep to that as well. Yeah, you've got the rectus capitis muscles. You are going to cross the splenius. Yeah, and the list just goes on. So apply it just below the occipital. So I'm going to use my 3 or 4 fingers, slowly curl in. My patient is going to flex and then rotate and do that motion. Okay, so they are going to flex and rotate and do that. If it is uncomfortable, we can look at an alternative motion shortly. So that's what my patient is going to do. Now, when he does the movement, I will probably get my fingers to about halfway, but he's gone all the way. So then he would come back and we'd start again. I suggest we take a breath in. Take a breath in, please. And as he breathes out, slowly do that motion, slowly. And I'm going to glide through those tissues. Hard to say exactly how much pressure. We don't want to use too much where we restrict the motion. So we have to allow the tissues to glide under our fingers. Take a breath. And again, so I'm going to come around. If I just change my hand, my fingers are going to come over towards the insertion on the clavicle here. Okay, so let's start that one again. Take a breath in. From there, slowly come round. So I'm reinforcing my fingers and I'm gliding down through that. Come back up, take a breath. And as he breathes out, I glide back through towards the clavicle, the distal end here. So what I tend to do it like in a fan-in sort of shape. So we do one way down, take a breath. And now I'm going to go slightly posterior to the first swoop, if you like, or fan. Comes down, and you can see I did that in one go there. Probably a little quick, so I tend to slow it down. So let's slow it down a little. And that means him and me, because I control by his speed and he's controlled by my speed. Good, that's it, and come back up. And off you go again. Coming across towards the scapula, you will get a little bit of a supraspinatus within that supraspine fossa as well. Come down, and again, off you go. Okay, coming down to the lateral border onto the spine of the scapula. So that's working mainly the trapezius and the levator. Now what we can do, you can place one hand over if you feel you are stable enough and strong enough, and I can control the movement of the head, and that would be known as passive, okay, like a passive release technique. You can call it PRT. Come down, so I'm gliding down through that. Okay, so I can control all of it. We can also, if we want to, ask a patient, take a breath in, please. Slowly push your head back. So he is activating the muscles for 10 seconds. So it's like a PIR of MET, which means post-isometric relaxation of a muscle energy. After 10 seconds, breathe in. And now he can then glide forward as I repeat the same process. so I can glide through the tissues knowing we've got a relaxed state. If I asked him to push his head forward, watch your oil on your hands and on the face, maybe just use a finger just lightly on the forehead, so he's just resisting against you there. Now the tissue's relaxed now, okay? So you could glide through with him pushing forward, so that would be known as a reciprocal inhibition technique. So there's many things we can do here. Even underneath the occipital area, we've got these rectus capitis muscles, the major and the minor along here, okay? So we can almost like, he can literally just extend his head a little, okay, good. And then you can almost glide as he just flex it, yeah, you're just doing that. So almost like just a little nod. So you're just nodding. So start there, and then you can just glide through there and come back up. So pretty good for headaches around this suboccipital region. Okay, no doubt you're still going to get part traps, part levator, depending where we are anatomically. Okay. From there, there's a few little triggers in there you might find. You might want to release them at some point. Relax. Once I've done one side, I naturally will go over and treat the other side. So we've done some soft tissue technique, mainly for the trapezius and the levator scapulae.